Hello, everybody. I'm State Senator Chris West, and I'm pleased to be here this morning with Dr. John Chessare, who is the President and CEO of GBMC Healthcare. We're going to talk about COVID and about vaccinations this morning. So, Dr. Chessare, so good to have you with us.
Good morning, Senator. I'm delighted to be with you.
So let's start off with a key question. You hear reports that some people who've been vaccinated have actually caught COVID. So what's going on? Does that happen often?
That does happen. We now know that both the Pfizer and the Moderna vaccines are about 94% effective, meaning that out of 100 people that get vaccinated, 94 are protected. They won't get very sick. Now, it's possible that they still might contract the virus and not know it, but they won't get sick from it. So therefore, it's one of the most effective vaccines ever, and we are very delighted when people will take it.
Great. Now, I understand that the vaccines were developed in record time with a real push to get them out as quickly as possible. I've talked to some people, I will be honest with you, who say that they're experimental. So can you tell us to what extent the scientific wisdom is that they're safe?
So the vaccines are very safe. And these vaccines came to market so quickly because they use a technique where messenger RNA is in the vaccine. It goes into your body and it tells your cell to make a copy of the spike protein from the virus. And your body then creates the antibodies against that spike protein. So this is a technology that has actually been around for about 3 decades. And researchers have been perfecting it for that period of time. The old way to do it would be to create actual coronavirus and then break it up into pieces and inject the pieces into the human. And the pieces couldn't create disease, but the pieces, the spike protein, would generate the antibody response. So with this messenger RNA technique, we can produce the vaccine much more rapidly. We don't have to go through the step of taking live virus and breaking it up. And the messenger RNA technique has allowed us to get millions of doses out there around the world very quickly. And the vaccine is very effective, as we just said, 94% effective, and is safe.
Isn't that interesting? All right. Well, tell me this: since your body is being induced to create one of these proteins, is there any chance it could get loose and infect you with COVID?
Well, the proteins are, in a sense, loose. They're in your bloodstream, just the way a spike protein would be if we got it from breaking up the actual live virus. There is no way you can get the disease from the vaccine because to get the disease, you need the entire virus. And the virus, the way you actually get sick from a viral illness is the virus gets into the body and then gets into your cells and creates havoc. The immune system reacts against it and eventually kills the virus. But in the interim, you get sick from it. With any of the vaccines, either one created from a spike protein or one created from messenger RNA, you're not getting the whole virus. So you cannot get you cannot get the actual viral disease from the vaccine. Now, there are some mild side effects that some people get from getting the vaccine, and the side effects are generally due to your own immune system kicking in, generally in a strong way, and you get side effects of that immune reaction. But it usually lasts 6 to 8 hours, and then you're back to normal.
Okay, I heard an old wives' tale probably from a friend that the way to avoid the side effects is by taking Gatorade. So I bought a six-pack of Gatorade and swilled the Gatorade down before I got my second vaccination. I had no problem. So I passed that wisdom on. I just heard from a friend yesterday who took my advice that it didn't make any difference. He still had a little side effects. Is there any way to avoid the side effects entirely?
Not really.
Okay.
And although we're not 100% sure, it appears that when you get side effect, it means you have had a relatively strong immune response, which is what you want.
Good. What about long-term side effects? Is it possible that once you've gotten vaccinated, something could materialize 3 months, 6 months, a year and a half down the road?
There's really no evidence that anything like that would happen, and there really isn't even a very plausible theory as to why you would have a long-term side effect.
Okay. And what about the people who have already had COVID and they've gotten over it? Are they sufficiently immune that they should not get vaccinated, or should they get vaccinated anyway?
They should get vaccinated, and it's to be absolutely sure that your body has created enough of an immune response. Getting vaccinated after you've had the disease will create no harm to you, and it's an extra measure of protection. So the CDC recommends that even people who have had the disease, that they get the vaccine.
So we've all, I'm sure, taken the flu shots year after year, year after year. And so what is the comparability between this vaccine and the flu shot? Is it more effective, less effective, or about the same?
It's generally much more effective. The way flu shots come to being is in the U.S. we look to the East, we look to Asia, and whatever strains of influenza are out there in a given year, those strains are used to create that year's influenza vaccine. But the virus can continue to mutate, and by the time it gets to the United States, it may not be, we may not have created a vaccine with great protection. And that's why some years it looks like the vaccine is more effective than others. It never gets anywhere near 94% effective. So the COVID vaccine is really a great agent.
Interesting. Let's talk about herd immunity for a minute. I think I read this morning's paper that here in Maryland, 67% of the population either has been fully vaccinated with the Johnson & Johnson single shot or has had at least one shot of the Pfizer or the Moderna vaccines. So that's 67%. And when you add the number of people who have had COVID to that and therefore have some immunities, are we near the stage of herd immunity at this point?
Well, that's a great question that no one can actually answer. It's different for each new virus. So it has to do with how easy is it for you to catch this given virus, because what herd immunity is saying is there are now too few people who are susceptible in the herd, in the group of people. There's too few people that can still catch the disease to propagate it and keep the epidemic or pandemic going. And that the number required to stop the spread of the virus varies from virus to virus. So we won't actually know what that number is until we sort of see the end of the pandemic. Now, from the data that we're looking at today, where the number of hospitalized patients continues to go down, and the rate of positive tests on people that are being screened is also going down, it looks like we're probably getting pretty close in the state of Maryland.
That's great. So is it safe for everybody to take the vaccine, or are there some people out there who should refrain from doing it?
There are rare individuals who probably should not get the vaccine. People with certain chronic illnesses should consult their physician prior to getting the vaccine. Okay. If anyone is concerned whether or not they should get it, they should contact their personal physician.
Let's devolve into politics for a moment. Myself have been impressed with how the Governor Hogan has handled this thing from day one. There have been some criticisms along the way. Do you think now, but now we're in the reopening stage, do you think he's going too rapidly to reopen the state, or just about right, or maybe too slowly?
Well, let me first say that I agree with you. I think Governor Hogan has done a very good job. And the thing that I was most impressed with at the outset was he immediately surrounded himself with experts. One of the potential issues for political leaders is that they try to make decisions without the correct information. Mm-hmm. I know a little bit about healthcare. I don't know anything about building bridges, for example. I don't try to make statements about engineering. I was really impressed that the governor, we are very fortunate in Maryland to have fabulous epidemiologists at the Hopkins School of Public Health and others, and he immediately went to those folks. So his decision-making from the perspective of public health and a scientist has been very good since the outset. I think right now we should be a little cautious in racing to eliminate all of the protections because we're not quite there yet. But I think now we know it is very hard to transmit this virus out of doors. So since the warm weather is upon us, most people will be outdoors. It does make sense to start backing off of the precautions. Indoors, especially since we don't know who has not been immunized, its prudence would tell you we should still be wearing masks. We should try to stay 6 feet apart, and we should wash our hands. If we know that everybody that we're with, like you and I today, are immunized, then we should feel comfortable getting back to normal. But if we don't know, or we know that someone has not been immunized, we should keep those masks on and we should keep social distance.
Well, let's finish up by telling people who have not yet been vaccinated can get vaccinated. What should they do?
So they can go to www.gbmc.org and they'll find an appointment for the vaccine. Up until 3 weeks ago, the rate limiting step was the number of doses available. Now everyone has doses. All of the hospitals in the area have vaccine. Many primary care offices, GBMC Health Partners primary care offices have vaccines, and the mass vaccination sites are still open and they all have vaccine.
Great. Well, thank you very much, John. This has been a pleasure. This is State Senator Chris West. I've been talking with John Chessare, who is the President and Chief Executive Officer of GBMC Healthcare. It's been a great interview. John, thank you so much for being with me, and thank everybody for watching.
Thank you very much, Senator.